Assalamu alaikum. I'm Dr. Mahwish, and as a medical professional, I feel professionally and ethically obligated to speak. There is a growing concern among Pakistani diaspora regarding the health of Imran Khan. These concerns are medical, humanitarian, and most importantly, urgent. What we are witnessing since October raises serious alarm. And if the reported sequence of events is accurate, then this is not a routine delay. This constitutes gross medical neglect, and from the pattern that it has emerged, it is increasingly appears to be deliberate. Let us examine the facts and the timeline. In October last year, Imran Khan reportedly began experiencing visual issues while he was in custody. And instead of transparent medical intervention, his weekly family meetings were suspended. He was separated from his incarcerated wife, and both were effectively cut off from the rest of the world. Even they were not allowed any meetings with their counsel. His symptoms did not resolve. They persisted for months. And there is no publicly available documentation of a comprehensive ophthalmic examination. No imaging, no medical reports were ever disclosed. No medical personnel has ever appeared on media to give us a briefing about his health or his current state of eye. He remained in confinement. He still is. Even the phone calls to his children were denied. Family access was restricted. Parties access was restricted. He was reportedly taken to a hospital which is not recognized for any advanced retinal care facility. A procedure was said to have been performed. But where are these operative notes? What was the procedure? What is the confirmed diagnosis? Where is the treatment plan? None of it has ever been disclosed. A court ordered that he must be examined by a specialist before the 16th of this month, Feb. This date has arrived. There is still no visible compliance. And in progressive vision loss, time is everything. Delay can cause irreversible damage to his vision. He was last seen by Barrister Salman Safdar with visible redness of the eye and congestion. He was wiping his eyes repeatedly. These are signs consistent with ongoing ocular inflammation or vascular compromise. There are reports that suggest up to 85% visual damage. And let us also be clear that he has refused to go abroad for his treatment. His demand is straightforward: save his vision, not relocation. Now we are being told that limited family access may be allowed. For months, similar assurances were given. Court orders were reportedly ignored. Promised visits never happened. A family representative was proposed by the council to be present at the time of his treatment. It was rejected. His sister, who is a qualified doctor, was proposed. Rejected. An alternative family doctor was also proposed to be present at the time of treatment. This was also rejected. When a detainee reports progressive vision deterioration for months, when independent specialist care or access is restricted, this situation goes into gross medical neglect. And if this pattern is intentional, it is even more serious. What makes this even more disturbing are some questions that is his healthcare being treated as a privilege instead of a right? And the worst is his medical access being used as a leverage? No detainee's health should ever become a bargaining tool. Medical care must never be conditioned, delayed, or selectively granted in a way that creates pressure, coercion, or silence. If access to proper treatment is being restricted to weaken him, to break his resolve, or to stop him from speaking out, this is not just unethical, it is a grave violation of medical ethics and human rights standard. Healthcare is not a reward, it is not negotiation technique, it is not a mechanism for control, it is a basic human right. And we are calling for full transparency. We now call upon national and international human rights organizations to independently review this case and ensure that proper medical standards are being upheld. Clock is ticking, and in this case, time is everything. We need to save this person from gross medical neglect and above all, save his life and his vision. We still do not know if his symptoms are because of some underlying condition that he must be having. We demand justice for Imran Khan.